So you've hit 3 months post-surgery. Your surgeon said your knee looks good. Is your knee ready to run? Not so fast. Table tests, they're not enough. Time, it's not enough, right? You need to be passing criterion performance-based tests to prove to your knee that you are indeed ready to run. So let's go ahead and dive in and see what those tests are. Prehab, welcome back to the channel. I'm Dr. Dorian St. Danik, physical therapist, strength and conditioning coach. Today, we're gonna dive into the criteria that ensures that we are ready to run after ACL surgery. So whether you're a weekend warrior or you're an athlete trying to get back to your sport, you do wanna go through this criteria of tests to ensure that your knee is indeed ready to run. And why would we do these tests, right? Outside from a professional just telling you to do them, biomechanically speaking, there is significance in passing these tests, and they impact how your knee will actually function after ACL surgery. So one of the first points we want to touch upon is load absorption. If your quadriceps, your hamstrings, your glutes, and your calves are not strong enough to handle the impact of running, which by the way is 3 to 4 times your body weight with each step and impact, well, that stress has to go somewhere, and it's going to end up in your knee joint. So if you don't have adequate strength, you're gonna go ahead and risk more inflammation or potential re-injury that's not being absorbed well through the muscle groups, but rather it's ending up in your knee joint or even other soft tissue structures. Symmetry. After we have this, unfortunately, catastrophic injury and then somewhat traumatic surgery, there's a lot of healing, there's a lot of inflammation, muscle groups will begin to inhibit or turn off, and we'll develop these asymmetries side to side. And you'll really want to take the time to pass these tests, because passing these tests ensures that you have more reactive control, meaning your muscles are going to turn on when the movement demands that you're asking your body to do are actually met with that muscle contraction, right? So you want to get that symmetry right so that you're not loading asymmetrically when you're running. Number 3, proprioception. Proprioception is just another term for your joint's awareness of where it is in space. Meaning, is your knee in a bent position? Is it straight? Is it bending or is it straightening? Is it to the left? Is it to the right? These are all brain communication patterns within our nervous system that tell us where our knee is in space and what direction it's moving in. When you have your ACL surgery, you lose those proprioceptive fibers in your ligaments, and typically you're given a graft where there are no proprioceptive fibers. So your brain and your spinal cord need to go through the process of reteaching your new ligament where it is in space. And so passing these tests gives us that dynamic stability that we're looking for, which running, yes, it's a straight line activity, but there's minor variations in lateral and even rotational stability. So you'll really want to have that joint awareness prior to going back to running. Plyometric readiness. So that's basically energy absorption and energy production, right? Think of like a spring or a pogo. It's your ability to absorb some of the force coming off the ground and your body weight getting into the ground, and then have that be a spring to then propel you forward. And oftentimes we need this stiffness, particularly in our Achilles tendon, our patellar tendon. These are crucial tendon pieces that will help propel us forward efficiently. If we don't have that plyometric readiness or that adequate stiffness in the tendon, once again, that load and stress has to go somewhere. It's gonna end up in your knee joint, and you might end up with an irritated joint if your tendons are basically lacking that stiffness and that plyometric power. Okay, last thing, secondary injuries. We see this all the time. You get back to running too soon, you start developing opposite side knee pain, you start developing some foot pain, maybe some hip strain, low back soreness. So if you're once again not symmetrical, or you're lacking strength on both sides potentially, or some symmetry on both sides, you might end up with those secondary injuries, which is really gonna slow down your recovery. And remember, getting back to running is a privilege, right? It's not that we prescribe running to really push us forward to the finish line in terms of strength, power, and agility, but rather this is something that's earned based on the initial foundations you did in the beginning stages. And in terms of timeline, we've all heard 3 months, and really the research is starting to show us that 4 months is actually more of a predictable factor, like a predictable time frame, right? 4 months is more reasonable. We also see that within our clinic and within our practice, that 4 months is what it takes to actually hit these metrics to their benchmark milestones. So this is not a process you want to rush. It's not the idea that you go back to running and that accelerates you forward, but rather you want to get strong enough, stable enough, powerful enough to actually be able to run and run safely. So how do we know if we are ready? Well, here's what you need to focus on. All right, so let's dive into the test. The first 3 are going to be covering the foot and ankle complex, taking a look at strength endurance, as well as that plyometric power or that like elastic stiffness of the Achilles. So test number 1 is the single leg heel rise test. This is going to test our 2-headed calf muscle, the gastrocnemius, under somewhat of like a strength and endurance demand. And we're basically going to go through 25 repetitions on one side and 25 repetitions on the other, and we're going to move at a tempo of 60 beats per minute. So really, really easy. If you can Google metronome on your phone, you can even download an app, but we're going to do this to the tempo of 60 beats per minute. So I want to use a pillar or a wall for balance, and I'm going to start rising, dropping, rising, dropping with every beat. And we're basically seeing, can we keep the same height throughout the entire repetition range, and how does it compare side to side? So I would go through my 25 reps, and let's say I get to rep 18, and I'm starting to lose some height, I can't quite clear it, or I can't keep the rhythm. That would be the pause of the test, and we would say healthy side was able to do 25, recovering side was able to do 18, and that would give you your current symmetry on your calf, your gastrocnemius endurance. Test number 2, very, very similar. It's going to be a bent knee heel rise test. So taking somewhat of like a single leg squat position, upright torso, knee goes as far over the toes as we can while the heel stays flat. This one's a little tricky, so definitely take your time in getting it right. But you're going to want to do a heel rise, heel drop, once again to the tempo of 60 beats per minute. And the trick here is to just stay moving at the ankle. It's not a lot of motion, as you can see, because I've closed down the angle at the ankle. What we don't want is straightening of the knee. That just changes the muscle group we're targeting. We want to keep it in the soleus muscle. Soleus muscle is going to be very important for shock absorption when we're in a bent knee position, which is basically what running cycle is. The gastrocnemius, the first test we did, that's a little bit more in charge of our propulsion. Think of your push-off in running. Test number 3 at the foot and ankle is going to be the single leg pogo test. So single leg pogo is basically hopping on the balls of the feet and trying to keep somewhat of a stiff foot and ankle in that plantar flex position. The rhythm is quite a bit quicker here because we're trying to go for that elastic or that stiff tendon presentation. And you're going to try to keep rhythm at 150 beats per minute for 30 seconds. So we'll start to hear how quick this really goes, and I'm going to go ahead and demonstrate, ideally with no balance, but if you need fingertips, that's not going to do too much to change the test. Your goal is really to do it and land in the same place every time. So here's our single leg pogo test. Which I would perform for 30 seconds. And once again, you're trying to meet that rhythm and you're trying not to collapse into your ankle, so letting kind of the heel hit the ground. And really you're also trying not to collapse at the knee. This is not a hip and knee dominant type of jump. It's really meant to expose the elasticity at the foot and ankle. So that's test number 3. And these are all somewhat standardized, meaning you're trying to hit this milestone, 25 reps, 15 reps, 30 seconds at those tempos that we mentioned, but it's also symmetry. So it's telling you how you did side to side. So a question we might have is, what if I don't pass these tests? Well, Means that somewhere along the way, in your first few months of recovery, you haven't built out the strength, so that's like maximum force you can produce, the endurance, just really strength over an extended amount of time, or the elasticity, which is that plyometric strength. It means that you're lacking capacity or performance in one of those realms. So if you didn't pass your first test, the single leg heel rise test, you may need some reprogramming around your gastrocnemius strength, and maybe that's going back to 2 up, 1 down, maybe it's some form of an assisted heel rise, or maybe it's just a little bit more programming of just the test itself, but you just need a couple more weeks to catch up. For the soleus, it's really the same thing. I could just be performing these here. I can go to a 2 up, 1 down, which is gonna help me load that eccentric phase and make some quicker gains on strength. Or I could even do this on a leg press, right? And put my knee in a bent position and go ahead and push that leg press with my ankle so that I'm getting that bent knee calf rise motion. And then finally, pogos. If you didn't pass your elasticity test, the pogos, there's so many variables of these, but you might have to go back to double, right? You might have to go back to a stagger and load that rear leg more. There's options to front foot elevate and bias that rear side. And then finally, one that we really like is rear foot elevated to bias that affected side. So you kind of just need to take a few steps back and reprogram, maybe some modifications, maybe some regressions in order to come back and meet those strength, endurance, and plyometric standards. We'd like to take a quick break to introduce the sponsor of today's video, Jane, a clinical management software and EMR that has completely changed the way we run our practice at Prehab PT. So if you're a physical therapist or any healthcare professional managing appointments, charting, and billing, you know how much time admin work can steal from your day. And we love how it keeps everything streamlined, intuitive, and stress-free. Switching EMRs can feel intimidating, but Jane makes it easy with onboarding resources and 10 out of 10 customer support to help with anything you need. Use code PREHABGUYS for a 1-month grace period on your new Jane account. Click the link below in the description to get started. All right, so our fourth test, it is a bit of a combination of ankle mobility, knee capacity or strength performance, and then hip stability and we'll say hip strength performance as well. So it's kind of a combination of all 3 joints, somewhat of like a functional test, and it's called the lateral step down test. So we are grabbing a step or a stair, and in terms of figuring out what height do you need, you're trying to achieve a 60-degree angle in terms of the bend angle at the knee. And when we line up our feet in line with each other, this affected side, the side that's going to be tested, should be at about a 60-degree angle. For most of us, it's going to be an 8-inch riser. Maybe your shin is a little bit shorter, you're going to go for 6-inch. If you're a little bit longer, taller, you might go for 10-inch, but for most of us, 8-inch does the job. We're going to line up to one side of the box. The hands are going to be on the hips so as to only isolate leg performance, getting no help from your upper body. And we're gonna reach laterally, right, or out to the side, so not in front, not behind, but laterally, and we're gonna get a heel tap followed by a rise through the affected leg. This is a qualitative test, meaning we're looking at the quality of movement. So we're gonna go through about 15 repetitions, once again at a metronome pace. This time it's 80 beats per minute. Why did we choose 80 beats per minute? This tends to be pretty similar to the cadence of running. So it's intended to create a little bit of a quicker tempo of movement that'll be reflected in that initial jogging interval that you get back to, right? So it mimics how we absorb, how we propel or push off at that somewhat of a higher tempo, right? That cadence that matches running. So I have my metronome here, hands on hips. And I'm doing 15 repetitions, all the way down, all the way up, heel tap in order to not push off with your toe. And by qualitative, we're looking at the angle of the torso. So is it side bend, is it rotated, or is it pretty much staying straight up and down? Does it look similar how it was up here to down here? Number two, we're looking at the pelvis and the hips. Is my pelvis aligned to the ground, or is my hip starting to poke out, or is my hip starting to hike up on the opposite side? So a level pelvis in relation to the ground. We're looking at thigh position. That's going to be some of my hip stability. Thigh position, can my knee track over my second or third toe, or is it starting to come inside my foot completely, which might indicate some hip deficits, hip stability, hip strength deficits. And then finally, tempo, right? Can I actually keep that tempo? And that's actually a little bit more revealing around our quad reactivity in terms of strength and endurance. So goal here, 15 reps, good mechanics. You kind of need a coach's eye, but basically anything outside of 5 to 10 degrees within those angles that we discussed is gonna create a need of concern, like area of concern. So if you're not passing this test, you probably need to go ahead and build up your obliques, your gluteus medius, your lateral glutes, and that can be through all sorts of side plank, fire hydrant, clamshell exercises, but even higher level work, such as lateral lunges, curtsy lunges, single leg RDLs, anything that's actually gonna target your side to side stability in the core and the glute. If you're not passing tempo-wise, you're lagging behind, you probably just need to build out your quadriceps strength through various exercises like squats, lunges, and then maybe assisted forms of step up and step downs. All right, so our next test is called the single leg rise test. This is really gonna go ahead and expose our quadriceps endurance. It's less about the quality of the movement. So you might have some tipping, the knee might be wobbling a little bit, but it's more about repetition. So it's gonna be maximum repetitions across 30 seconds. There's no metronome here. You're just trying to go as fast as you can, going all the way up and coming all the way down. In order to set up this test, you're gonna need somewhat of a taller riser. So that could be a chair, a couch. We have a plyometric box here. A plinth table works well. A gym bench works well. But the angles are important. And what we mean by that is when you grab a seat, and if I can show you from this angle right here, if I grab a seat and my heel is 10 centimeters away from the edge, I need my knee to be at 90 degrees when I'm on that plinth, right? So if it's too low and I'm sinking below 90 degrees, I need to bring myself up. But basically we want to find a 90-degree angle as we're sitting on the edge of the plinth, 10 centimeters away from the box. And that's just gonna help us standardize. So you might have one level of height and you might need to add some risers or lose some risers depending on what kind of surface you have. So I'm gonna line up 10 centimeters away, get my 90-degree angle. My hands are gonna go on my hips. The timer will start and I'm gonna go as many reps as I can up, down, across 30 seconds. So here's what it looks like. Up, down, up, down, up, down, up, down. And again, you might be leaning, wobbling a little bit. That's not the exact concern in this test. It's more how many reps can I get? We're looking at symmetry within those 30 seconds. So did I get about 90% or should I have gotten 90% symmetry side to side? And for all the tests that we're doing, we're looking today for 90% symmetry, right? Or at least with the heel rise test, at least with the bent knee heel rise, at least with the pogo test, and then that lateral step down. We're looking for 90% symmetry within these first 5 tests, including this one. For maximum, for how many repetitions should I have gotten in general, there's a consensus that 22 repetitions, whether it's your healthy side or your affected side, is the number you want to shoot for before you go back to running. So that's just kind of giving us like an absolute number that we're shooting for. So find 22 reps, 90% symmetry on your single leg rise test to ensure that you have good quadriceps endurance. If you're not passing these tests, find some volume with squat patterns, lunge patterns, even the leg extension machine, and you should start seeing improvements within your rise test. All right, so for our 6th test, now we're actually getting into higher impact, a little bit more of that like power demand, which is gonna be strength, but with some time constraints. It's all happening really quickly. We're gonna be exposing our ability to really absorb load fairly quickly. So this one's the single leg drop landing. We're gonna find our riser. This is a mixed bag on how high you wanna come off of, how high of a step you wanna come off of. If you're down as low as 4 inches, it's not really much impact, much speed, or much power demand. So we like to typically test it at 6 inches, maybe even 8 inches. It kind of depends on what type of programming you've had around this type of stimulus, that landing stimulus. But try to get somewhere around 6 inches to actually expose some flight time and then that subsequent impact. So I'm gonna step up to step as a qualitative test. So we're looking at the quality of movement, kind of like we did the single leg lateral step down test. We're looking at torso angles, pelvic angles, hip angles, and then most important, quad control. Can I catch myself in a 45-degree position with my torso and my shin at the same angle quickly and not have any movement after I hit the landing? So hands on hips, we step off and we catch ourselves in that single leg landing position. So it's great to get a front angle on these to once again measure torso, pelvis, and hip angles. But side angle is also important because it's gonna tell us 2 things. Did I get that adequate angle of 45 degrees at the knee? Or am I overloading my joint and going way too stiff? Or is my quad eccentric strength and power lacking that I land, but I have to keep going down to catch myself, right? So finding that 45 angle, best seen from the side. Number 2, remember that torso angle. So am I landing but overutilizing my hamstrings and glutes to absorb? Meaning I've hinged too much from my torso and this angle of my torso no longer matches my shin angle. Or do I have a good balanced landing strategy where I get my knee and my hip to cushion and absorb? And we don't need a lot of repetitions here. 5 to 8 repetitions, comparing both sides, trying to get about that 90% qualitative symmetry for this one. You should be able to get some data around your power through your knee, as well as some of your power through your hip and your core. If you're not passing these tests, scale things back, work on your snap downs, work on your split stance snap downs, grab a dumbbell, a kettlebell, do drop catches, do med ball slams, do exercises that mimic that speed and reactivity that comes with single leg landings. All right, for our next test, so we're gonna take a look at the counter movement jump, which is basically a vertical jump with momentum coming down, a push off up, and then a subsequent landing. If you're fortunate enough to have access to force plates, you're gonna get a lot of good data around how symmetrical you are when you push off and how symmetrical you are when you land. So we're using the Vald force decks here. And the test would be a double leg vertical jump. So the setup is hands on hips, dropping down, jumping up, and landing in a stable athletic squat position. The data that you'll get from this test will tell you your symmetry side to side. So how did you push off, and then how well did you absorb your landing? So the metrics you want to look for here, 80% symmetry on the push off, 85% symmetry on the landing. So this is really getting accurate, even better than our coach's eye, to tell us how we're gonna push off in running and how we are going to land. But if you don't have access to this, there are some other valid and reliable tests that you can substitute and still get some data on how well you're pushing off and how well you're landing in terms of side-to-side symmetry. So let's go ahead and take a look at the alternative to the counter movement jump on a force plate. All right, so the alternative to the counter movement jump done on force plates is going to be our single leg forward hop. This test is a little bit different because it'll actually tell us a little bit more about our hip function and our calf function or our ankle function. So it's gonna tell us the power that's coming out of the glutes, the power that's coming out of the calves, and how much distance did we cover based off the push-off, primarily coming from those two regions. If you're gonna measure distance, you're gonna get data on those points and look for symmetry. But if you have the ability to film yourself doing this or having a professional do the same for you and take a look at it, you're gonna also be able to do a qualitative assessment. And if you remember what we were talking about in the single leg drop landing, looking for angles in which we get about 45-degree knee bend and a similar angle of torso to shin, the same rule applies here, meaning I can have pretty good symmetry with a left-sided jump and a right-sided jump, but if my affected side landing looks like this, while my unaffected side landing looks like this, I'm probably lacking some knee performance, some knee capacity. So let's take a quick look at the test from two different angles to kind of give you an idea of how to self-assess this. I just have a marker to tell me where I'm gonna start. My second marker is gonna tell me where I land. I'm gonna wind up on one leg, hop forward, stick my landing. That's about as far as I made it. All right, so I had somewhat of that forward lean on that landing. I wouldn't say I was quite able to absorb well through my knee. I had to ask too much help and assistance from my hips. I'm gonna run it again. And this time I had more of a knee dominant, or at least a balanced type of landing where my knee bent, my hip bent, but my torso and my shin were at the same angle. So from a side view, if I take off, I want same angle shin, same angle torso, as opposed to too much torso, not enough knee. So quantitatively, the numbers matter here. 70% side to side is what you need in terms of distance, but qualitatively, the landing should be looking good in terms of those knee and hip angles. So if you're lacking 70% distance, build out your calf strength, build out your glute strength, RDLs, hip thrusters, deadlift variations, that'll help with the glute. If you're lacking around knee mechanics, get back to those eccentric power demands, those snap downs, med ball slams, drop catches, work your quad under speed and strength demands. All right, last test, probably, it is the most important test, okay? Because it's gonna be specific and isolated to knee function, quadriceps strength, or at least knee extension force, which is driven primarily and significantly from our quadriceps. And when you look at the armor and resilience and protection around your ACL, the quadriceps is a primary stabilizer. The more strength I have through my quad, the better in control I am of my shin position, my knee position, and that really dictates, am I putting a lot of strain on the ACL graft? Am I putting the optimal amount of strain on the ACL graft? And these numbers are not only important in this phase to tell us return to run, but it's your clearance for return to play and return to sport as well. So make sure that you are doing this type of test. And at this point, finding a practitioner and professional that has access to the very least a crane scale or like a weight scale, maybe not the Tindeck that we're using, but at least a crane scale, you'll be able to get some valid and reliable numbers side to side. If you actually didn't even have access to this test, you should definitely be on a leg extension machine, looking for your repetition maximum side to side. How much weight can I push for 5 reps on my non-affected? How much weight can I push for 5 reps on my affected? Is that a 70% symmetry? Will tell us if we're appropriate for return to run. So this test, I'm already hooked up to the anchor. I have it at a 90-degree angle. That's what's easiest for our squat rack position. Typically, you want to go ahead and hold yourself down in the surface that you're on. You can add a thigh strap as well, maybe some weights on the bench here so it doesn't move, but you kind of need to be locked in. And then it's not necessarily a speed movement or test, but it's max force. So you're probably going to hit your max force within about 2 to 3 seconds of pushing out. So the test starts with the cue of go ahead and push out as hard as you can. So I start to drive through, push, 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 and I pause, right? And I've done basically knee extension with my left side, utilizing my quadricep. I'm gonna get a number on the iPad that's gonna tell me how many pounds of force I put out, and I can compare that to my opposite side. We also have another video that covers, well, how do I know I'm actually strong enough on both sides? Am I working with 2 flat tires, or am I optimally strong on my unaffected side as well as my affected, so that my comparison is actually fair to a limb that's adequate enough to hold me up? There is a nice little easy formula where you would measure the length of your shin, how many pounds of force you put out, and you'd be able to see how strong am I for my body frame, basically. So you can go ahead and check out that video, but do not skip this test. It is really, really important. It's directly related to the safety of your knee joint, of your ACL, and oftentimes we'll see passing with flying colors on all the other tests. We move like athletes, we have good movement variability, efficiency, all the other more dynamic tests look really good, but hey, I might be 65% or 60% on my isolated, very revealing test. I gotta take time to reload my quads. Leg press, squats, lunge variations, whether it's split squat, front foot elevated, rear foot elevated, and don't forget about leg extensions themselves. They are very safe to do very early in rehab and pretty heavy in rehab as well. We do not want to skip the leg extension machine. All of our clients make sure they have access to that in their gym and that they're getting progressive overload on the leg extension machine. And as a disclaimer, it is of utmost importance to consult with your medical team, so make sure you are discussing return to running post ACL surgery with your physician and your physical therapist, because they are going to have the most specific outlook on your individualized recovery progress. So in summary, focusing on these criteria and passing these benchmarks ensures a safe and effective return to running after ACL surgery. Remember, patience and adherence to your rehabilitation program is the process that will take you in regards to actually meeting these milestones. If you enjoyed this video, don't forget to like, subscribe, and share it with someone else on the road to recovery.